of Ikorodu. Nothing unusual except that we have a broken down high capacity bus at mile 12 inwards Koshofe. That's the source of the headache at this time for those of you who are navigating through that corridor. And I'm just pleading for some levels of patience right now. All right, then. So from the Shango Tedo end, the total area of coverage is looking pretty good to go as we speak. Excellent vehicular movement is being experienced from Ilaje up to Aja underneath the Jubilee Bridge. That's a long stretch indeed, but it's looking good. Heading towards Adobado Railroad, both in and out, connecting areas like Alesh back to underneath the Jubilee Bridge is also looking pretty good. And we can tell you, movement proceeding towards Abraham Adesanya from Aja is also very good, both in and out. So no major worries driving through those corridors if you are within that end too. All right, then. So those of you making the journey towards the island on the Third Milan Bridge, I hear that the traffic is easing out right now. Earlier on, we had the backlog somewhere around Chinatown, but it's much better now. It's just a little bit around Alakbere, inwards the construction zone. That's where you have it at the moment. Beyond that point, it gets better, heading towards the Third Milan Bridge. Looks pretty good on the bridge, but of course, approaching areas like Unilag Waterfront, things begin to slow down a bit. Nothing unusual there, just high influx and loads of vehicles on the road. All right, Lagos-Abeokuta Expressway coming in from the Dokpemu end, linking up with Cement, still looking relatively cool. Approaching Ilezik, you might have a little bit slow there. Of course, that's a merging point, by the way. Those that are coming in from the Sule end of Agege Motor Road, connecting with those proceeding from the Yanokwaja end, and thus you have it a little bit slow there. 4 lanes is there, and of course, by the time it migrates towards National, things begin to thin out a bit, and it slows down. So that's what you have within those particular corridors. So we'll be serving you more helpings as they come in from time to time. Today on Your Side Mirror, we are shining a spotlight on a crucial aspect of maternal health. We're talking antenatal care and expert support for every delivery. Well, we're doing this because there's time for much more advocacy in terms of ramping up efforts for reproductive, maternal, newborn, adolescent, and child health in Nigeria. When we look at the figures, it's not very, very pleasant, all right? When we go through some of the statistics that we're getting, we're still having women that are losing lives, trying to bring children to life, which is supposed to be a pleasant journey. But this morning, we'll be discussing the importance of antenatal care, expert support during delivery, and how expectant mothers can prioritize their health and well-being. And we'll be doing that from the perspective of a particular hospital that has been into this for quite a while. We're talking our Jolad Hospital. And joining me in the studio this morning, I have Dr. Alima Aliu Ayo. She's the head of obstetrics and gynecology unit or perhaps department for our Jolad Hospital, and she's right here in the studios. Dr. Aliu Ayo, nice to have you in the studios. Good morning.
Good morning. Thank you for having me.
Great.
It's a pleasure to be here.
So for those who might not know, we're talking antenatal care, but it might sound like it might be like a high-sounding word or perhaps much more technical. So break it down for us. What is antenatal care?
Okay, thank you very much. Antenatal care, simply put, is a specialized care given to pregnant women throughout the course of their journey by a healthcare professional, and this involves regular checkups, antenatal classes, counseling, and support during actual pregnancy in order to, pick risk factors which can be associated with adverse outcome in pregnancy.
And why is it important?
Well, antenatal care is very important because it's an avenue to pick up. Usually, pregnancy is supposed to be a happy and pleasant experience, but sometimes can be associated with risk, which can lead to complications, which can in fact lead to maternal morbidity and mortality, as well as perinatal morbidity and mortality.
All right.
So when you do antenatal, you're able to pick up some of these risk factors. Like some women have coexisting medical conditions in pregnancy, like hypertensive disorders in pregnancy, pre-existing diabetes. They could even have diabetes, gestational diabetes, meaning diabetes existing for the first time in pregnancy. Some people have bleeding in pregnancy. So many other, risks can be picked up in pregnancy, and by that doing, you're able to intervene promptly to prevent adverse outcome.
So let's look at this in proper, or perhaps put it in context. Back in the days, or in the days of our ancestors, there was nothing like antenatal care. I mean, what they all did was a woman to get pregnant, and from point A of conception to point of delivery, perhaps they would have gone in and looked at traditional methods and all of that. So how did it become a subject of discourse now that we have to pay so much attention to maternal care?
Because that's what in those days, maternal mortality was quite high. That's what we're trying to reduce.
Okay.
So with proper antenatal care, you're able to pick these risk factors. You're able to modify the outcomes and reduce maternal mortality, perinatal death, generally.
All right. So how can expectant mothers, how can they benefit from regular antenatal checkups, so to say?
Okay. When a woman gets pregnant, it's important for her to, at least she will do a urine pregnancy test at home to confirm the pregnancy. Then she should see a doctor to confirm the pregnancy, and then probably do a scan to determine the location of that pregnancy, because sometimes some pregnancies can actually be ectopic, meaning that it's not inside the uterine cavity.
Okay.
And then the number of fetuses sometimes can be twin gestation, triplets, multiple pregnancies, and then they book for antenatal early, usually within the first trimester of pregnancy. And with that, we're able to do prenatal screening where we pick investigations, we'll do a lot of screening for even STI like HIV, because some women don't even know they have HIV. It's during antenatal you pick up this infection, and then you're able to treat them and prevent transmission of mother to child.
All right. So are there warning signs that will show that this pregnant woman might not be having it right the way it should be, or perhaps maybe the baby is not sitting the right way? Are there signs that would indicate that?
Sure. A pregnant woman knows her body, so it's important to be very observant of any changes in your body. But there are some warning signs, like red flags, that shows that something is not right with the pregnancy. For example, when a woman is bleeding in pregnancy, it's not normal. It might be pointed to maybe a miscarriage, particularly early on in pregnancy, or even abnormal sighted placenta, like placenta previa, abruptio placentae, which can be quite life-threatening. So when you notice such, you need to present to the hospital early. Other warning signs include headache, blurring of vision, which might be a pointer to hypertensive disorders in pregnancies like severe preeclampsia, eclampsia, which can affect the whole system and can be life-threatening. Other warning signs include reduced perception of fetal movement. When you notice that your baby is not moving as it should, is a pointer to a serious problem. So you should rush to the hospital quickly, because if the baby is not moving again, there's no miracle anybody can perform.
Right.
But if it is reduced, we can, intervene.
Okay.
Yeah.
Okay, so these are some signs that a pregnant woman should watch out for. For first-timers, are there anything unique that they should look into? Because I know there are mothers who, if probably they've had one or two, so the experience is there. They can leverage on past experiences and all of that. But for first-timers, any particular word that will make them understand the fact that, you're still very much on the right track, or perhaps there's a danger lurking around?
Absolutely. First-time moms, we classify them as high-risk pregnancy. They are primary gravidas. They did not have that experience before. Their pelvis has not been tried before. So, in fact, they're at risk of some conditions like hypertensive disorders in pregnancy, severe preeclampsia. Sometimes they could have big babies, malpresentation. So they need to book antenatal early. They should not wait until when there's a problem before coming to the hospital, and they should, ask questions, be involved, advocate for themselves, and in order to have a healthy pregnancy and safe delivery.
For that woman who refuses to go for antenatal care, any dangers involved? I mean, we have some people who will say, maybe due to some beliefs or due to some, I don't know how to put it right now, but they just feel, it's better she stays at home, we'll look after her, and of course, would nurture her till the point of delivery. Any dangers in that?
Of course, a lot of dangers can be associated with doing that, because when you come for antenatal, we'll do all these screenings for you. We'll give you prenatal supplements. because pregnancy is associated with increased demand. Sometimes they come up with low blood level, which you call anemia. So it's important for you to, and then if they are not on their routine supplement, they might have anemia, which can even cause anemic heart failure. Sometimes when they fall into labor, you can't predict how labor will go. They could be bleeding after delivery, which we call postpartum hemorrhage. And it can be quite life-threatening.
Okay. So it's very, very dangerous for a woman just to sit at home and feel that maybe through home care remedies, maybe they'll be able to.
And then, in fact, some patients are like really high-risk patients with previous cesarean section deliveries. This is not the kind of patient that should sit at home or go to faith home or go to a church or go to a traditional birth attendant, because there's risk of uterine rupture.
All right.
Yeah.
We'll talk about this even as the program moves on. But Dr. Aliu Ayo, what are some common misconceptions about antenatal care that you think should be addressed? Talk to me.
Oh, well, about antenatal care, some people believe that if you've had 2, 3, 4 babies, you don't need to attend antenatal care because you're already experienced.
Exactly.
You don't need any guidance, because that is not true. Any pregnancy can have complications, right? But the important thing is for you to identify them on time and intervene quickly, and have the right team in your care to give you safe delivery. Yeah.
So are you saying no two pregnancies are the same?
Absolutely, no two pregnancies.
You mean it? But I've gone through it once, so if I've gone through it, the second time should be much easier.
It might be different.
Okay, so that's one misconception. Any other misconception?
Another thing is some people believe that ultrasound is harmful to the baby. We do routine scans during pregnancy. Ultrasound is 100% safe. It doesn't harm the baby in any way whatsoever.
Okay, so ultrasound. I needed to break that down for our listeners.
Ultrasound scan is a type of scan where you used to check the baby's heartbeat, the weight, the baby's movement, and everything pertaining to the well-being of the baby.
Right. So some believe that
it's harmful, just the way some people believe. Well, like X-ray may be harmful to the baby,
right?
But ultrasound is safe. It's 100% safe.
Okay, so that's a misconception, right?
Yeah, that's a misconception.
So mothers should be very, very willing to go through that kind of ultrasound test,
because we need this test to assess their baby's development throughout the course of the pregnancy.
All right. Any other misconception? None to think about right now, right? Okay, but in terms of age, is age a barrier for safe delivery?
Well, age
could
pose a risk to safe delivery, particularly teenage pregnancies. Yes, teenage pregnancies, because their pelvis are not well developed, and when they fall into labor, they are at risk of obstructed labor, and they are also at risk of, abdominal delivery, cesarean section, and so on and so forth.
And what about old age? Is that a problem? I mean, like a woman who's in her 50s or perhaps late 50s.
Well, older women are at risk of medical conditions in pregnancy, like hypertension, diabetes, and so on and so forth. And of course, that
is the point, that expert support is needed.
Yes, absolutely.
Okay.
So you need a specialist in your care to monitor the course of pregnancy.
All right. So let's talk about expert support now during delivery. How impactful is that for maternal and infant health outcomes? Talk to me.
Okay, it's important to have a specialist on your care during antenatal period and delivery to monitor the pregnancy so that you can have a healthy pregnancy and a safe delivery. One, to, like we said previously, to look at the possible risk that can be associated with pregnancy, prevent complications, screen for other infections, and also, give you a wholesome experience throughout the pregnancy.
Now, to rewind a bit on the issue of misconception, because I was just about to bring that in. Some do say that once you have your baby, perhaps your first child, with a cesarean section, you can still go back and have normal birth, without the cesarean. Is that correct?
That's correct. That's not a misconception.
It's not a misconception.
Yes, you can have a vaginal. What's a misconception is, after having a cesarean section, you must always have a cesarean section.
Is that correct?
It's not. You can have a vaginal birth after a cesarean section, but this must be under the guidance of a specialist, because that's a high-risk patient who already has a scar on the uterus and is at risk of uterine rupture,
right,
and at risk of bleeding at delivery.
So that must be properly monitored.
Yes,
to ensure
closely monitored to avoid maternal mortality and complications.
Right. So let's talk about the time frame now. So at what point should women begin antenatal care?
Okay, usually antenatal care you begin from 12 weeks gestation. You should book for antenatal at 12 weeks gestation. But for people with high-risk pregnancies, or like people who have had multiple miscarriages, they should book earlier, like as soon as they miss their period and they've confirmed pregnancy. Okay,
they should just come and register for antenatal care right away.
Yeah.
So what roles do skilled birth attendants, what roles do they play in ensuring that we have safe deliveries? Talk to me.
Yeah, skilled birth attendants are people who are trained to manage labor, to avoid complications, and they play a major role in ensuring a safe delivery. And also manage the pregnancy during the antenatal period. They provide all the support you need, counseling, and manage any risk that might lead to complications.
All right. So as nice as all of this that we're talking about may seem this morning, Dr. Aliu Ayo, I know that there are still some barriers in Nigeria towards accessing antenatal care in several communities. So talk to me, how can these barriers, what are some of those barriers, first off? Let's even know them. For people to access antenatal care, from what you've seen in your practice as a medical practitioner for several years?
Well, poverty is a major challenge. People do not have access to good healthcare facilities where they can access proper antenatal care. And then lack of education. Some women are not empowered, they don't have jobs, they're not able to pay for their care, and poor health insurance, health financing can also play a role.
So these are all barriers.
Yeah.
Let's talk about how our Jalad Hospital is trying to change the narrative. Talk to me. What are the facilities that you have available? What are the kind of expert support that you provide?
Okay, at our Jalad Hospital, we offer a comprehensive antenatal care where we, individualize patient care. We run antenatal clinics that consultant-led. When I say consultant, specialist-led, you have an obstetrician and gynecologist in your team, in your care team, from beginning of antenatal up until delivery and even after delivery. And then we have 24/7 emergency services, like round the clock. If you have if you see any danger sign or red flag, you can come to the hospital. We're always available to attend to you. We have multidisciplinary team, expertise. We have obstetrician and gynecologists on our team. We have experienced midwives. We have anesthetist. We have neonatologists that will take care of the baby that you deliver. And, it's a complete team. And then...
Okay, just a second. Let's see if we can take this call. Hello there.
Hello, good morning.
Good morning.
Good morning.
I'm glad you have the Jalad team there.
Yes, we do.
I heard everything about the response to the same. Is it the same Jalad hospital that did not treat that young lady? Who was the one with an accident that she died on the operation? Is it the same Jalad or is another Jalad?
Okay, just hold on 1 second. Hold on 1 second. What's your name? What's your name?
The young lady who had an accident about a year ago was brought to Jalad and Jalad is to hospital. I'm sure the lady is and I remember address it. I'll listen about the radio.
Okay, please do. Even though we're not talking about a young lady who passed on, I'm making reference to our Jalad Hospital. I don't know, is that your hospital that we're talking about?
Is our Jalad Hospital? My hospital is our Jalad Hospital. We're talking about antenatal care. Okay. I don't know what he's talking about.
All right. All right. So, but even though we're having one or two reactions, we'll take that very, very shortly. But then, in terms of the facilities you have hospitals located in what locations?
Okay, I'm not even done about it. They will also offer pain-free labor, like epidural and analgesia, where you do not feel pain at all throughout your labor. What does that mean? It means that we, in collaboration with an anesthetist, we offer pain-free. You don't feel pain at all throughout labor. Labor traditionally is known to be extremely painful, but we give you pain-free labor through the use of epidural analgesia.
Okay. You offer that within your services.
Yes.
So at every point when a lady is to deliver, you must have how many set of professionals on ground?
We have the midwives, obstetrician, neonatologist. We have the whole team. We have a functional theater in case there's need for cesarean delivery. We have blood bank services if there's need for blood transfusion.
Okay.
Yeah.
All right. Lagos Traffic Radio 96.1 FM. This morning on the program, we're looking at, safe delivery from antenatal. And of course, up to expert support services. And I have Dr. Aliu Ayo in the building. She's the head of obstetrics and gynecology for Al Jalad Hospital. Message here says, good morning and happy new week, everyone. Please, ma, what dangerous signs should a pregnant woman never ignore? She is sending this one in. She, thank you so much, even though I know she has touched a bit on that earlier on. But, doctor, you want to respond to Sheyi?
Okay, thank you for that question, Sheyi. So there are some signs that you should never ignore, like when you are bleeding in pregnancy, it's not normal. You should see a doctor as soon as possible. If you have serious headache, it's not normal, see a doctor. Blurring of vision, if you have drainage of liquid, like seeing water through your vagina, it's not normal. When you are not in labor, like maybe in the first, second, and early third trimester, please see a doctor. And then if you notice that your baby is not moving well, see a doctor. You have a fever, see a doctor.
Okay. Then, so I hope that's well taken. This one says, good morning, doctor. Is it okay for pregnant women to fast during religious fasts? Okay, you didn't put your name, but thank you so much. So is that normal? Should a woman who's pregnant, should she be fasting at all?
Well, that's controversial.
It's controversial, right?
Well, it depends on you. It depends on you.
No, but from the point of view of a medical practitioner, what do you think? Should she fast at all?
Well, as long as she's able to get the required nutritional nutrition she needs, maybe for a few hours, but not for too long.
Not for the whole day?
Yeah.
Okay. So the person sending this message, anonymous, please do that in moderation. Maybe 3 hours, right? Or 2 hours might be suitable, but just don't go the whole hog of saying 8 to 9 hours or perhaps a whole day. All right. This one says, good morning, Mr. Victor and Dr. Halima. Please, ma, can a pregnant woman safely travel long distances by road? I am asking because my heavily pregnant wife is adamant on traveling home to visit her sick mom, and I'm worried. Mr. Ibrahim is sending this one in. Thank you so much.
Okay, thank you. It's not safe to travel long distance by road because there could be risk of preterm contractions, preterm labor. She can fall in labor en route without any help in view, so it's not safe.
It's not safe at all.
Yeah.
Okay. All right.
Rather, maybe if she's not up to 36 weeks, maybe she could fly by air if it's that important to her.
All right, let's take this call. Hello there.
Hello, Victor. Good morning, sir.
Good morning.
Yeah, just a quick one on Ikorodu Road. My name is Adebayo Taufik.
All right.
Yeah, just to inform motorists now who are now in heavy traffic from Ogoloto inward my 12 now, that the Primero Blue Bus that had earlier caused a very severe traffic has been moved away now.
Good.
But of course, after that, we had another broken down judiciary vehicle now on top of my 12 bridge. That one is being attended to by LASTMA officials. So motorists coming from Ikorodu to exercise patience as we are trying to make all things together for us to, remove this judiciary vehicle as well.
All right.
The first one, Primero Blue Bus, has been evacuated, and for now, there's about 60% road available on the main carriageway in what to Shopper now.
All right. Adebayo Taufik, thank you so much for that update. All right, that's the spokesperson for the Lagos State Traffic Management Authority, and he has just been able to let us know that breakdown we've been talking about earlier on, Mile 12 inwards Koshofe Primero bus broken down is successfully evacuated, so you should have it much better, even though there's another breakdown on top of the bridge, Mile 12 bridge. Yes, it says there's another vehicle that's broken down there, but we still have the main carriageway very much in good shape as well. All right, 08099120777 and 091538771 27. That's the numbers that you can call. All right. This one says, how can expectant mothers navigate the healthcare system just to receive quality antenatal care? Doctor?
Okay, thank you very much. Well, for an expectant mother, it's important to get a good hospital that has a facility to take care of you in the event of an emergency or complications, and attend routine antenatal clinics. So every pregnant woman deserves a healthy pregnancy and safe delivery. Okay. Therefore, it's important to get a good team and attend regular antenatal clinics.
Right.
Follow your doctor's instruction, ask questions, and that is what we offer at Arjolat Hospital.
Let's take this call. Hello there, good morning.
Hello, good morning once again. This is traffic manager Anabanjo from my 12.
Okay, Anabanjo.
The earlier reporter, Blue Bus, have now lived locked now.
Okay.
We are having better movement from my 12 towards K2 at the moment.
All right.
While our officer on ground are doing the needful.
Beautiful.
At the moment. That's just the we are asking for you at the present. Meanwhile, there's another high capacity bus that belongs to civil service. But at my 12, while descending, it's too much on ground.
Right.
But all hands on deck to move it out of the road as usual.
Okay then.
That's the update for now.
Anabanjo, thank you so much for that update. Also corroborating what Taufik Adebayo has sent to us earlier on. So that's what we have at the moment. Okay then. So if you still want to be part of the program and talk about antenatal health care, feel free. I still have with me in the studios this morning Dr. Ayo Aliu. That's Aliu Ayo, who is the head of obstetrics and gynecology department for Arjolat Hospital. All right, as we gradually wind to the end of the program, Doctor, I need you to just give me some personal experience stories, right? I'm sure you must have seen one or two stories that by the time they came to the clinic, it was quite touching, but with the intervention of your team, that brought a whole lot of relief and it ended with a whole lot of joy. Talk to me.
Okay.
Can you recall any?
Well, there are so many experiences. But the one that readily comes to mind would be...
a young lady, or was she old? Okay. Why you ruminate on that? Why you still reflect on that? Let's let you know, those of you around the Lagos-Abeokuta Expressway corridor is still looking very, very good from the Dokwamu end. But approaching the Lezik, things begin to slow down a bit there. Those of you heading to the island, making use of a co-bridge is all good from Funshaw Williams. Link it up with a co-bridge, but approaching a co-bridge, things begin to slow down there as well. All right, 08099120777. This one says, greetings to you, Vicky D, and also Dr. Halima. This is Biodun from Lekki, but now in Adion. All right, Biodun, thank you. So I understand that the goal of antenatal care is to ensure a healthy pregnancy, delivery, and postpartum experience for both the mother and baby. He said, I had a case where my wife and I lost our first baby despite screening tests, health education, regular checkups, follow-up visits, and ultrasound scans. So yet there was a stillbirth. The baby died in the womb in the 7th month of that year. She was induced and she delivered the baby, but not alive. So sad. We do understand. Now, he now says, anyway, there's a lot on this, but I just need to react to this person. Quite unfortunate that they lost their first baby. That's Biodun. Very unfortunate. But, doctor, he says they've done everything. In this kind of situation, what do you think could have been done?
Yeah, I'm so sorry about your experience, Mr. Biodun. I really empathize with you. But it's really unfortunate. The truth is, some women have some coexisting medical conditions that were not picked up during antenatal.
So the test could not detect it? Is that what you're saying?
Maybe, and if she was, I don't know if she was regular with antenatal clinics, antenatal care. Sometimes some might miss some days, and then your BP shoots up, affects placental circulation and can affect the baby. So many factors can be responsible. And the truth is, you cannot save everybody, that's the truth. But we're trying to minimize the
incident of
bad outcomes.
Right. Okay. All right. Biodu, so sorry that that happened to your wife.
This is a patient with a bad obstetric history. So going forward, her next pregnancy must be closely monitored by a specialist.
Okay.
From antenatal up until delivery.
That's the way it should be.
That's how it should be going forward.
All right. All right. I don't know if you're able to remember any.
Well, the commonest one will be anemia in pregnancy. A lot of women have anemia because in this part of the world where poverty is quite predominant, there's nutritional anemia. So we see a lot of pregnant women in our clinics with anemia.
Anemia meaning
low blood level. So we have to, optimize their blood level. Sometimes we co-manage with another specialist, which we call hematologist. And at the end of the day, if sometimes it might even require blood transfusion.
Right.
Because if there's anemia, it can impact negatively on the outcome of the pregnancy, particularly at delivery, where you don't know what can happen. Sometimes some people bleed. And if you have low blood and you bleed a little, it affects you more than somebody who is already at the PCV is quite high.
All right.
Yes.
Is there any kind of support? Let's begin to look at the kind of action that we all should be doing to ensure that our wives deliver safely and that we're able to bring in healthy babies. So what's the call to action this morning?
Okay, for pregnant women, they need a lot of support because pregnancy is actually a lot of hormonal changes. They have a lot of emotions here and there, anxiety, fear of the unknown. So they need a lot of support from their spouses, from their parents, siblings, friends, to allay their fears and also to, help stabilize their emotions.
Right.
And, spouses should try to follow their wives to the clinic, support them with their nutrition, and even logistics of how to get to the clinic.
Okay, that is required as well.
Yes. So it should be a team,
It's not a collaborative work.
Yes, it should not be only the woman doing the work.
So the very big question now as we round up the program. So what happens with the other room, with antenatal care? Once a woman is pregnant, we see how, men who say, well, this particular function was not stopped, right? Is that the advice from medical doctors?
It's okay to have sex during pregnancy, except otherwise prescribed, depending on maybe there's a condition, a medical condition that it can affect.
Like a lady who has high blood pressure?
She can have sex.
She can still?
While on treatment.
Okay. And should that be a sparing kind of activity or should it be regular? Doctor,
in moderation.
We're waiting for your expert advice.
In moderation.
In moderation.
Yes,
okay.
In moderation.
All right,
and gently too.
Gently.
By the way.
All right. So, thank God that you're bringing that to bear this morning. And your final thought on the program, what's the message? What would you like to convey to our listeners about the importance of antenatal care and expert support, especially from our Jalad Hospital?
Okay, like every pregnant woman out there should take their health in their hands. They're in control of their health and that of their baby, so they should book antenatal care early, come for checkups, advocate for themselves. And at our Jalad Hospital, we offer a comprehensive antenatal package where we, take care of you we'll hold your hands throughout the journey, walk you through every step of the way, from your first ultrasound even up to the point where you carry your baby in your arms at the end of the journey. So we're here for you.
All right, then. I love the way you printed it. Thank you so much for being here, Doctor.
Thank you so much.
All right. So we've reflected a bit on safe beginnings, antenatal care, and expert support for every delivery.
We have locations in Bagada, Isolo, Agege, and even Ikeja.
All right.
So you can walk into any of our clinics to book a consultation.
Okay, then. We'll leave it at that for now. Dr. Halima Aliyu Ayo is head obstetrics and gynecology with our Jalad Hospital. And this morning, we've been able to, go on that discussion on how we can have safe deliveries for every child. A brief break. When we return, the program continues.
Dr. Abimbola Mabogunje, I'm the Permanent Secretary, Lagos.
Joke Orilope Adefulire. That's a name you cannot ignore right here in Lagos. Former Deputy Governor, Lagos State. Happy birthday to you, ma'am. We wish you the very, very best of this day. Pa Olubumi Olukayode Oluwole Triple O, clocking 84 today. I understand your father to Buki Uwona, who is also Assistant Director. All right, she used to be with the Office of the First Lady of Lagos State. I don't know if she's still there. All right, but happy birthday to you, sir. As you clock 84 on this day, your children, grandchildren, they are all celebrating you on radio. Victor Olukayo. That's Victor Ekundaye is celebrating an alumnus of Obafemi Awolowo University. Today's your day too. Happy birthday to you. Hamid Oladipupo Okunuga is celebrating. Nollywood actor, I understand. Happy birthday to you. Pharmacist Olakunle Okilola is celebrating. Executive Director with Clinics Healthcare. Maximum shout out going out to you. Shamsuddin Olatunde Abdul Malik is an ardent listener to Traffic Radio. This is from your wife. That's Rukayat Abdul Malik, and of course, son Farid. All right, happy birthday to you as you celebrate on this day. Joke Silva is a name you cannot ignore in Nigeria. Clocking 64 today. Veteran actress, you know her too well. Today is her day. Osamide Ezima is celebrating. Happy birthday to you. Dr. Kemi Omwaka is a food. That's Food as Medicine Health Services. All right then. Maximum shout out going out to you. Adeboale Shamsuddin Olarewaju is celebrating. Happy birthday to you too. And Adisa Hassan, today is your day. We're wishing you well. Dr. Kunle Taiwo is also celebrating, often referred to as KT. All right, today's your day too. We're wishing you well. Caroline Iyoha is mother to Roberta. That's Roberta Okpaifo of Lagos Traffic Radio's Programs Department. Caroline, happy birthday to you. Wish you the very, very best. Happy birthday to Mrs. Adefuye Moturayo Adijat. Today's your day. You're an admin and human resource staff with the Civil Service Commission right here in Lagos. All right, then. Happy birthday to you. Afolabi Bolu Blessing is also celebrating, a.k.a. Mommy Enoch. All right, to all of us who are celebrating this morning, we wish you the very, very best, and we pray that God will surprise you in a great way. Congratulations. I can tell you, even from the live cameras in the studios, it appears the situation is changing around the construction corridor. So we're having some slow movement right now inwards Alakpore. It's a slow and steady kind of movement being experienced there. Those of you on Ikorodu Road, it should be getting better now. Earlier on, we had the removal of that broken down Primero bus that's been causing a whole lot of headaches for you. I hope it's getting better now. You can give me a shout or perhaps let me know what's happening there. If it's much better where you are. Ejigbo corridor traffic is busy from Keno back to Mubostik. NNPC junction at the moment is a busy one. We have traffic managers on ground doing the needful within that corridor as well. Okpaibi Allen right here in Ikeja, busy on Obafemi Awolowo Way, and that's from Radio Junction heading towards Allen intersection. It's a slow and steady kind of movement. And then from there, down to Ikeja underneath the bridge is good. Ikeja underneath the bridge, the return journey to Allen intersection down to Radio Junction is also looking good. We can tell you Arumire inwards Allen intersection busy, while of course the return journey is also looking good. We can also let you know that vehicle movement on Kudirat Abiola Way from Ojota inwards Welfare Junction and Ikosi Junction down to Radio Junction looking pretty good. Likewise for the return journey. Ikosi Road from 7 up inwards Oregun Junction is busy while the return journey is looking good. Okpaibi Link Bridge in and out of Adebola House is busy too, while the return journey is very, very good. Okpaibi Road from Sheraton inwards Salvation up to Okpaibi Roundabout is busy as well. Tony down to Allen also looking a bit busy, but no major worries driving through those locations as well. All right, then I know that we've had lots of incidents on the road. Some of you sometimes having to, say that having the right kind of enforcement, but in all times, like we always say, LASTMA, they've always given some options for you to give them a call. If you have any issues, there are ways you can reach out to them and you can sort out those things. Maryland, I understand that due to excessive traffic on Ikorodu Road, vehicles are being diverted through that corridor, right? Specifically the Onigbongbo U-turn near Northwest Filling Station. That's what motorists were making use of that corridor to connect Bank Anthony, just to ensure that you can have it good. All right. So like I was saying, for any issues that relate to traffic management, you know that LASTMA, they're always very willing to hear from you. The general manager has put in place the kind of communication that you need just to ensure that you can move. And they've done that across all the zones. They even have a toll-free line that you can always reach out, to them to put in those calls. And once you put in those calls, they'll be able to escalate and bring some levels of intervention. So if you feel that you've been wrongly enforced, or perhaps the kind of treatment you got on the road from the traffic manager is not very, very suitable, LASTMA, they are always very willing to hear from you all the time. You always get justice, right? So no matter what the situation is, they have what they call TMS, which is a technology that they use to, take traffic management to another level. But you can always contest it, right? Your toll-free line is 08000 527862. That's 08000 527862. It's a toll-free line. By the time you put your calls through to that line, definitely somebody will be there to respond, and then they will take your complaints and take that to the next level. We have to go now. Time, not really our friend this morning, but of course tomorrow will be another day where we'll be reflecting on a whole lot of issues. But Mike James has produced the program this morning. Maximum shout out going out to Okwayemi Shodunke of our social media unit, and our executive producer is Tayo Akonli. My name is Victor Terry. Have a splendid day. Bye.